If we have a person who has injuries to the chest and the lungs, they will have difficulties breathing. But one of the things we're afraid of is that when they are breathing, air will go in through the puncture and collect between the lungs and the chest. And this can give us complications. I will show you the first aid that we can do to cover the hole so that when they're breathing out, air does not get sucked in. But we also need to put them in the recovery position. And it's important that we put them in the recovery position in the right way. A lot of people will put the person with the injured side up. Now this is wrong because of gravity. And now I'll explain you why. You see, here we have the lungs. And if we have the injured side here, there might be some blood, there's a punctured lung. This lung is on 0%. Then we have a lung here that's 50%. If we put the healthy lung down, we have all the body weight lying on it, and it cannot expand. And this will minimize the amount of oxygen and air we can get into the lung. The pressure from the body diminishes the 50%. And now we might only be at 35%. And the blood here could go down the airways into the healthy lung and fill it up with blood. And now we're no longer on 35%, but maybe only on 15%. And so we've actually made the situation worse. So it's important that we put the injured side down when we put a person in the recovery position. Now we've assessed the casualty. We can see that he's pale, he has blue lips, he's coughing blood, he might be breathing like and coughing blood up and the sound of like when you blow bubbles with a straw might be coming from here, from his mouth. We also have a puncture wound here that can also present a problem. So now we need to treat this wound right here. And the thing we do is we cover it in plastic. This square goes over the wound. If there's so much blood that the tape cannot stick, then we will have to wipe the blood away. Put the plastic on top. Take our tape. Now you can see I've covered all the corners except for one corner. And this is because the blood that is seeping out of this wound needs to be able to run out and go out through here. You see there's a hole through here. And this is so that the blood that is coming out from the puncture here will go out through this hole where we put him over to the recovery position. If he has an injury like this, there might be an exit wound. It can be anywhere on the body. It might be down here, it could be in the leg, it could be in the arms. But if it's on the back, if there was an exit wound here, we would do the same thing. We would put a piece of plastic and do exactly the same thing, cover it up, and make sure that there's a hole on the side that is going to turn down. Now we need to put him in the recovery position. And we do this to make sure that the airways are clear, that is if he is coughing blood, which he probably will be in this situation, the blood will come out of his mouth and not go into his airways or further down into his lungs. And it's important that the side that is injured is the one that's turning down. Now I'll show you how we put a person in the recovery position. We take the arm of the sick side and put it over the head. Take the opposite arm and put it down in between here. Then we lift the leg that is furthest on the same side here, push on the elbow and on the knee, and roll him over to the side. Now his mouth is turning down. This means the tongue will go out. If he's coughing blood, it will go out of the mouth. If he's lying a little bit on the belly, we can pull the leg further up to ensure that he's on the side. This ensures that the lung that is here, the healthy lung, will keep breathing. The treatment that we've done here is turning down. The blood will come out of the hole and come down on the ground and will not go into his lungs again. Now it's important that we keep sure that he's breathing. Sometimes it can be a benefit if we pull the head a little bit back so that we are sure that the airways are free and the blood can come out. here I have a blanket, and when we put this around him, we need to also make sure that we isolate him from the ground. So we need to get under him. So we put the blanket over his body, get it under him as far as we can. We might have to roll him a little bit and put it under his body as well. It's important that the part that we keep warm is the upper body, the chest, and here, because this is where all the vital organs are. And this is where the body itself will want to stay warm. It's okay if the legs get colder or the arms. The most important part is the body. But if we have enough blanket, it's a good idea to also cover the legs as much as we can.